Take Care of Your Body by Rye with your host, Rylin. The autonomic nervous system controls and maintains homeostasis. Does yours work effectively? Stay tuned in to see what's next.
I hope you're smiling because it's me, Rye. Hi, everyone. So today I'm with the Dysautonomia Project. Would you guys like to introduce yourself?
Sure. I'm Cheryl Faber. I'm the Director of Education Project and very excited to be here.
And I'm June Bryant. I'm one of the board of directors, and I'm also a practicing pediatric nurse practitioner in the community.
Thank you so much for being here. So I have a few questions that I want to kind of teach my audience a little bit about dysautonomia, what it is, and I know you guys are the perfect people to have on to help me with this. So are you ready?
Ready?
Definitely.
Okay, I'm so excited. So what is dysautonomia or autonomic dysfunction?
Okay, so I wish it was a very simple answer, but it's really not. Autonomic dysfunction, and you may also hear it termed as dysautonomia in the community, refers to a group of conditions that are characterized by a dysfunctional autonomic nervous system. The autonomic nervous system is responsible for involuntary bodily functions such as heart rate, blood pressure, digestion, and temperature control and respiratory rate. So when the autonomic nervous system isn't functioning properly, it can lead to a wide range of symptoms, including that affect multiple organ systems in the body, which makes this different than a lot of other disorders. Because when we think about let's say a condition that just affects our respiratory system. Let's say you have a cold, right? And that mainly affects your respiratory system. The problem with this is that not only does it affect multiple body systems, but every patient that's diagnosed with the type of autonomic dysfunction differently. So it makes it a little bit difficult there. Autonomic dysfunction can vary widely. Some is like dizziness or lightheadedness, fainting or near fainting, like syncope. It can present as tachycardia or bradycardia, so fast or slow heart rate, lots of sweating or lack of sweating, constipation, nausea, vomiting, fatigue, weakness, and those are just a couple of symptoms to name a few. What also makes this difficult is a lot of the symptoms, they can be subjective, which means that it's whatever the patient, whatever that you're feeling and you have. Not a lot of them are objective, like a specific lab test, something that, we can just order and say, yep, that this says that you have autonomic dysfunction, right? So it can be difficult in that way. Do you want me to keep going or
You can keep going. That's the whole point,
okay.
is to kind of like share a little bit about what it is, because I feel like it's a term, I have dysautonomia, like I was telling you guys before we started. And when I tell people that, I explain it, they're like, what is that? What is POTS? What? You mean like what you cook with in the kitchen? Because I'm a chef, so everyone expects that from me. And I'm like, no, it's not. And I think it's sad because it's something like, they'll be like, oh, it's in your head. I don't see any of your symptoms. Nothing that you're explaining to me is visible. You look fine from the outside. And I'm like, yeah, we're going to have a whole conversation about what dysautonomia is. So keep going. I'm very happy with the definition of what you're giving me because it's anything better than I could have looked up. So,
So you've made such a great point, Rylin, that so many people that experience forms of dysautonomia don't look sick on the outside, but are extremely unwell on the inside. So it's like an invisible condition, but it's not an imaginary condition.
absolutely.
And we hear all the time patients saying, I was told it was in my head, or I just have anxiety, or, go see a psychiatrist and get some medication. And it's so much more than that. And that in and of itself makes it really challenging for someone walking through this.
Absolutely. It's really sad to think about that because, like, I have anxiety. So I was like, yeah, I don't think this is my anxiety. I've had anxiety since I feel like I was a baby. And I actually had one of my own healthcare providers tell me that. And I was like, no. And I told my mom, and thankfully my mom is in the, medical field. And she was like, no, there's something wrong with my daughter. So we left that physician and she started to take me to her medical mentor, who is an endocrinologist, and she's amazing. And she actually was the one who mentioned POTS to me. And I was like, what is POTS? So I think that's a perfect place to start. Do you know what POTS is? How to explain it to people. So I think that the best place for me to ask you is, what is POTS? How can you explain POTS to anyone who's listening and they might not know what that term is?
Sure. So POTS is postural orthostatic tachycardia syndrome, and it's basically a disruption in it's an orthostatic condition, which means it usually presents itself when you're sitting up or standing up. And it's an irregular drop, usually in heart rate or rise in heart rate that that can cause these symptoms to occur when you're in an upright position. And the symptoms that occur can be passing out, it can be feeling dizzy. Difficulty standing still is one of the interesting things because with the change in blood circulation in the legs, it changes your move all the time with POTS when you're in an upright position to try and get the blood flowing more. Fatigue, weakness, brain fog. Thank you. Yeah, and so it can present itself. And again, what's interesting is that the severities differ, and not every patient is going to exhibit all of these symptoms. It may only be 1, 2, or 3 symptoms. And the other interesting thing about POTS, and remember I said that these disorders or these conditions, they affect multiple body systems. In POTS, the 3 main body systems that it affects is our nervous system, our cardiac system, and our GI system. So usually patients with POTS will present with varying symptoms, but in all of those different body systems, which is really interesting. You don't see that with a lot of conditions. Exactly. And what else do you want to add about POTS specifically?
I think you've done such a great job of describing it. The key thing with POTS is you're going to have symptoms in multiple organ systems. And so finding someone who is able to look at you as a whole person and take all of the things that you're saying you're experiencing into consideration is really important, because otherwise it can seem like you've got to see 10 different specialists for the 10 different things you're experiencing. That may or may not be the case depending on how severe it is, but having one person who, and it could be a primary care provider, who can look at you and say, let me put all these puzzle pieces together. And between looking at all of your organ systems through a thorough patient history and taking a good set of orthostatic vitals to show that sustained increase in heart rate, then you can come to a diagnosis for POTS and be able to provide some help. The good thing is with POTS, there are a number of non-pharmacological options that you can do to improve quality of life, body movement, increasing salts and fluids, compression garments, especially abdominal garments to help get that blood flowing. Those can make a big difference for many people.
Absolutely. And I think it's crazy that there are like over 15 forms of dysautonomia.
Mm-hmm.
So that is something that when I researched into it, I was like, wow, how can one term for a chronic illness have so many different forms? That is crazy. So the next question that I have is, can you tell me a little bit about the history of the Dysautonomia Project?
Sure. Well, we're actually celebrating our 10th anniversary this
Oh my
year.
gosh,
We're
that's
so excited.
awesome.
Yes, yes. So the Dysautonomia Project was founded by Nate and Kelly Freeman and Kelly's mother, Karen, 10 years ago. Kelly was a very successful businesswoman, very active mother and volunteer in her community and at church. and a routine dental procedure just sidelined everything. She became very ill and bedridden with no answers, and she couldn't find any answers in the local medical community. So she is very persistent and diligent, and she really began her own journey to find out what was wrong. And finally, in 2011, she connected with Dr. Randy Thompson in Pensacola, and she and her husband Nate spent 5 hours with Dr. Thompson. And for the first time, she began to understand what autonomic disorders were, and what is this umbrella term dysautonomia, and what is POTS, and these other forms. And she got a diagnosis. And during that journey, she realized that there is this enormous gap in knowledge between what autonomic specialists know and what community-based providers know. And this was just not acceptable at all. And so she said, we're gonna start a nonprofit organization to give hope through education. And so in 2014, that birthed the Dysautonomia Project and our mission.
And I'm so happy that the Dysautonomia Project was born, because it truly has impacted my life completely. So what an amazing woman. And you guys are two amazing women that I'm so honored to now know and to be connected with. So thank you so much for just like being a part of such an amazing organization, and for all that you do, because it truly impacts people like me.
Oh, thank you. That's why we do what we do.
Yeah, no,
I'll tell you a little bit about why I got involved, because
I'd love to hear that.
if you don't mind, a little bit of a personal
I love
story.
Absolutely.
So when let's say it was about 12 years ago, I can't believe it's been 12 years. When I was in practice and I was just starting out as a nurse practitioner, and I did have a patient that came that had all of these. Well, first she came with chest pain. And it was a very odd symptom for me. And I did all the things that, we were taught to do with chest pain, and she, it wound up getting worse and worse. And it got to the point where I had referred her off to so many specialists and no one had answers for it. Not only was my patient left feeling hopeless, so was I. Patients come to us for answers. And when you can't give them those answers, you're left feeling like a failure and hopeless too, because that's our job. We're supposed to help. So I had one of the specialists did call and talk to the physician that I worked with and said, do you think that this could be Munchausen's by proxy? Which Munchausen's by proxy is a condition where the parent is intentionally harming the child for attention, for financial gain, for something that's not in the child's best interest. And so that had me questioning everything. I'm like, oh my gosh, what? And then I was like, there is no way. There is no way. So finally, we did get her to see someone who suggested that it was POTS and some type of autonomic dysfunction. She had answers. I had answers. It was something that I hadn't learned about in school. And I couldn't believe it. I couldn't believe that something this devastating, and something that it essentially was not easy to deal with, but something I could have given suggestions to help with so easily, was being missed. So I wound up going and working for the school district, and TDP, the Dysautonomia Project, came and gave a presentation on POTS. And I'm like, oh my gosh, I have to be a part of this, because I don't want any other provider or anyone in the community not knowing what this is. This is super important. So from that day, I was like, I need to be involved. I walked up to Cheryl and I said, please, I want to be involved. And then I started talking with them and talking about educational opportunities. And then I was invited to be on the board of directors, which was one of the best. I was so honored, and I still am. And being able to make a difference and go and educate, because like I said, I don't want any provider to feel the way that I did. So now TDP comes and presents to our class. I'm also a University of Tampa professor. And so they come and present to all of our nursing students every semester. So no one leaves here without knowing what dysautonomia is. So I'm so excited about that. And so, yeah, that's my story. That's why I got involved with it.
Oh, well, okay, so from what I got is you're a total girl boss. First of all.
She is a total
You
girl
are
boss.
like you just saying that you do all those things. I'm like, wow, I'm so fatigued. I don't even think I can do any of that. But no, I do push through and I am like doing okay with my condition. But so from what you said, I kind of first want to say thank you so much for not giving up on your patient. I kind of got a little teary thinking about that because I related it to some of the own doctors that I have and the ones that didn't give up on me no matter what, the lab test said or what, feedback that we were getting from any of the results that were showing. So I do have a question that I kind of just came up with what you were saying. So do you have any advice to someone that is kind of spinning around not knowing that they're having any of these symptoms?
Oh, that's a great question
That's a great
because
question.
there's so many that are dismissed that do feel hopeless. And my biggest you have to be your own advocate
Absolutely.
and you have to be persistent. Now you want to remain pleasantly persistent, not demanding, but know that you have something going on and you're not going to stop fighting until you know that you're with someone. And there are people out there that are aware. And I'm sure that Cheryl's going to talk about some of the resources that TDP offers, but be persistent and don't stop looking. Don't give up. There is someone out there that's going to listen to you. Yeah, I mean that's the best advice that I could. Do your own research, and another thing is to go to your providers with your research. Say, I think I may have this, Now, of course, you may not know what you have, but being persistent in doing research. But if you come to them with a suggestion, they're more apt to probably look into that because you have a lot more time to spend on what you're feeling probably than they do when they have 15 minutes with you in a room, So coming with your own research and your own suggestions is always helpful too.
Definitely. And
So,
a great
yeah.
tool, a
Mhm.
great tool to go along with what June said is our patient assessment tool, which is on our website. It's the first of its kind. It was rolled out last summer, and either diagnosed or undiagnosed folks can go on there. If you're undiagnosed, putting in your symptoms can help you determine if you're at a lower or higher risk for autonomic dysfunction. And you can get a printout that you could take to a physician or nurse practitioner, whoever your provider is, to say, here's kind of where everything is falling. Can you help me figure? But June's absolutely right. Being your own advocate, getting someone in your corner, coming alongside the Dysautonomia Project with resources and the patient education program we do in the summer, and just learning as much as you can, and hopefully finding a provider. And they are out there. It's just finding them who care and are willing to listen and take the time. And it does take a lot of time with patients with autonomic disorders. That can be a real challenge, but they do exist. There's a lot of great people that want to help and are going to stand by you through it.
Absolutely. So my next question is what does the Dysautonomia Project do? How would you explain that to someone that is just, learning about it?
Sure. So we're a nonprofit organization, and our sole mission is education. Our mission is to educate healthcare professionals, communities, and patients about dysautonomia. The cool thing is, 10 years in, we're now the global leader in dysautonomia education. There are other dysautonomia organizations that might focus on research or support groups, but we solely focus on education. And so we do that through lots of different ways. We have a very robust website. It's got information for patients and providers. We've done a video series in collaboration with the American Autonomic Society. These are the top autonomic experts in the world. We have our award-winning book that was co-authored by Kelly and Dr. Thompson and Dr. David Goldstein, who is really just kind of a legend in the autonomic disorders world. We offer in-person education. We'll go to like speak at June's classes at the University of Tampa. We'll work with providers to go into hospitals to do grand rounds. We will go into the school systems. We will attend national conferences. Fortunately, June is so well regarded in her profession and so well connected that at conferences where she has been invited to be national speaker, we will go too and have an exhibit, and we'll pass out our books and, really work well together to drive more education. We believe that the number one form of treatment is education. So we just stay in that lane, and that's what we do.
Absolutely. And I'm so happy that you guys are out there doing what you do. So what are some of the missions of the Dysautonomia Project? I know you touched on that a little bit, but if you want to add some more insight.
Sure. Well, our mission is solely education. So everything that we do, every decision we make, every dollar that we raise, it all gets funneled to education. And we're excited this year to be able to really expand our educational offerings. We are growing our medical ambassador and advisor programs. Those are experts in the field. Medical advisors are experts in the field, generally members of the American Autonomic Society or other national certification, to be resources for us for our content. The medical ambassador program we're developing is with the local provider community who can step in and be a resource for us, but also help us educate. So we're really growing those. We're expanding into more school systems, trying to expand into more university programs, expand presentations to professional organizations, anything to do to put this on the radar of providers, to make them know that this is out there and give hope to patients.
Absolutely. I think that's truly so important. And I'm so happy that you guys have such an important mission of educating and education, because it's like really the kind of building block for everything.
It is. And we're just very, very grateful for the support of our board, the support of our community, the support of our donors, and especially the Hawkins Foundation. They generously underwritten a lot of our activities and have really invested, which is allowing us to do what we're doing this year.
Absolutely. So the next question I have is, what is one thing you want everyone to know about the experience of someone that suffers with dysautonomia?
The one thing that's really important is to know that no matter what kind of dysautonomia or what type, it has a profound impact on their life. And it can be an impact that really impacts one part of their life or a lot, every aspect of their life. It's not just a collection of symptoms, it's super complex, and often it's debilitating, and it can affect their physical health, emotional health, their well-being, and overall quality of life. And it's important that, again, as Cheryl mentioned before, these people that are diagnosed with this often look okay. They'll have days when they're out and walking around and being like everyone else, but then that may have took everything that they've had out, and they may be down for a couple of days after that just to recover from what the activity and the exertion that they did to look okay. I really love, Cheryl always gives this spoons analogy. So I'm going to have her say that, just because it really puts it into perspective for someone who may not understand what this does.
Right. So if you imagine everybody wakes up with 20 spoons in the morning, for someone who does not suffer from a form of dysautonomia, POTS, for example, that's one of the most common forms. For that person, it might take, to get up, to go downstairs and eat breakfast, to get dressed for the morning and head out to school or work, maybe spoon. For someone with POTS, that could take 5 spoons just get, and another several spoons to get downstairs and try to eat. And if they are able to go to school or work, it could take 5 more spoons. So here's someone who does not have POTS, has used 1 spoon by the time they get to their destination. Someone with POTS may have used 10 already. And so every activity that happens from the smallest to the biggest throughout the day takes effort, takes energy, takes a spoon. And so pretty soon, it's not even 10 o'clock in the morning and someone with POTS has no spoons left. And therefore they're down, they're fatigued, they're in bed. And I've only used 2 spoons. I'm still going, I'm going through the evening. So that analogy just goes to show how impactful these symptoms are on someone who has POTS. What's interesting is that 85% of patients who are diagnosed with POTS are female. They tend to be young female. It can really happen at any age, kind of puberty up to age 50, but the majority seem to fit in that teenage 20s age range, typically Caucasian. It will spread across races, but it's that young, high achieving, lots on their plate, lots of stress in their life, maybe, Caucasian female who seems to be impacted the most right now.
Wow. I love that little analogy you gave. I think that's really going to help people listening to understand what people with dysautonomia go through.
Mm-hmm.
So I have 2 more questions before we run out of time. Do you have any upcoming events that you want listeners to know about?
Yes, definitely. June 15th, 2024, mark your calendars. That's just a few months away. We are hosting our annual patient and caregiver virtual event called Discourse. And it's going to put education right in the hands of those who need it most. And this is our 2nd year doing it. It was extremely popular last year. We had over 700 from all across the US. We reached into 8 different countries. We're doing it again this year and anticipate an even higher number in our audience. We've got incredible specialists in the field lined up. It's from 12 to 5. The good thing is it's virtual, so you can, if you need to stop and take a rest, you can, but it's going to be a really amazing. The registration fee is $10 until April 16th. That's in honor of our 10-year anniversary. It goes up to $20 and then $25 on the day of. But please go to our website and register. It really is an outstanding opportunity to learn from the experts in the field. So that would be the biggest thing. Make sure
I'll
you go
be
to the
there.
website and register. www.dysproject.org.
Okay, so the last question I have is, if anyone is looking for more resources to learn about dysautonomia, does your project offer any?
Yes. So again, I go back to that website. There is so much information on the website. There's a page that just helps somebody understand what dysautonomia is. There are lots of educational videos for providers and patients. That patient assessment tool is huge. Even if you've already been diagnosed with POTS or form of dysautonomia, it can act as a symptom tracker. So we encourage people to go back in and use it frequently to see if there's any change patterns in your symptoms. So go to the site. There's listing of our events coming up and volunteer opportunities, ways to get involved. Our book is great. We say, get one, give one. So if you don't have one, get a book for yourself to read it. It's really well written. A nice way that Kelly formatted it is on the left side of the book. It's written in layman's terms for patients. On the right side, terms for the provider. And it's now, well, you can get the book on our website or on Amazon. It's now offered in Kindle version as well. And cool side note fact, it was just translated into Japanese.
Oh, that's
So
so cool.
yeah. So, and the other thing that's good is to take a book to your provider or someone who's willing to learn about this, and that will be great as well. And lastly, send us an email if you need help. info@dysproject.org. Oh, the website also has a great provider finder on there. So if you don't know where to start, go to that. You can put in your zip code and it'll bring up names and contact information for providers that can be of assistance. And if you or your audience has a provider who is not listed on our provider finder, please give us that information so that we can add them. We are constantly looking to build that so that there's more and more resources for people.
Thank you so much for sharing that. And I truly want to thank you both for joining me today. I really think that a lot of people listening will learn a bit more about dysautonomia and can advocate with us for it.
Well, thank you for what you're doing and for reaching out, and please stay in touch with us.
Absolutely. I will be staying in touch with you guys. And if there's any project that I can be involved in, I would absolutely love to.
Wonderful.
Oh, thank you. I will remember that and call you.
Yes, I will. Do you want me to send you over my phone number?
Yes, please.
Okay.
That'd be
I would
great.
love to. Thank you so much. It truly was a pleasure. You guys are doing amazing things.
Thank you,
so much,
Rylin. Thanks for all you're doing.
Thank you so much for joining me. Bye.
Bye-bye.
Thank you for listening to this new episode of my podcast, where I talk to the Dysautonomia Project. If you or someone you love has dysautonomia, or if you think you might have dysautonomia, look into the Dysautonomia Project's website, where they can help you understand a little bit more about this complex condition. Thank you so much for listening, and as always, with love, Rye.